You can have a dental infection and might not even be aware of it. I just had a patient come in with a swollen face on the upper left, and we took a traditional x-ray, and I said, hey, I need a little bit more information. Can we take a CBCT, which is a 3D x-ray? And then he said yes. We took the CBCT, and we found out that not only he had a huge infection on the upper left, he also had the same infection on the upper right. He had no pain on the right, no discomfort, nothing ever bothered him, but he had the same pretty much size of infection on the right and the left side, and he wasn't aware of it. So what I told him is, ideally, he only has two options really. He either takes out the tooth or he gets a root canal. Now, I don't usually recommend root canals, although I do give it as a treatment option, because like I told him, hey, these are your two options. You always have some bacteria left even after doing a root canal, because we're leaving a dead body inside the mouth, right? So naturally something that's dead is gonna attract bad bacteria. But I said, if you don't wanna take the tooth out, that is your other best option. Because at this point, I'm just trying to decrease the amount of infection that he has. And actually, to further keep talking about the same topic, we gave him antibiotics in this case while he's waiting to make a decision. But he actually ended up having to go to the hospital because the infection was so big that the antibiotics weren't even working. So at this point, I would just suggest to pick an option, either do the root canal or the extraction, but you have to do something because you have to decrease the amount of infection in that tooth. So sometimes the routine visits at your dentist are actually not doing the work. So take your health into your own hands and actually go to a holistic dentist that understands health and that actually has equipment like CBCT technology to really diagnose any dental or silent dental infections present in your mouth.